and welcome to the Hit Like a Girl podcast. I'm Joy Rios, and today my guest is Dr. Natasha Ramontal. She's the Digital Health Strategist for Community Outcomes in North America at HIMSS. You'll hear soon enough for yourself, but she's on a mission to make a global impact by increasing access to healthcare. And no matter where she's chosen to work, her passion and vision drive her to make a difference. She's the kind of person who I imagine when her feet hit the floor in the morning, the universe thinks, watch out world, she's up. Take a listen. Natasha, thank you so much for joining me today. I love to think, I'm sometimes get overwhelmed by just our whole healthcare system. There's a lot of parts and pieces to it, and it doesn't seem to matter how much you study or what you know, like there's always more to know. And so I keep thinking like, okay, is it a 3,000 piece puzzle? Is it a 10,000 piece puzzle? Is it just like a stupid amount of puzzle pieces? But if you could maybe take a moment to introduce yourself and help me and our audience understand your part of the big picture within the health IT puzzle.
Sure. So I am Natasha Ramontal. I am the Digital Health Strategist at HIMSS, the Healthcare Information Management System Society. And my responsibilities include a digital health indicator, which is a measurement tool to measure health systems' digital capacity and their journey on this digital health transformation or our healthier ecosystem that is made up of digital health and all these design tools and it connects clinicians and provider teams with people that are enables them to essentially connect and manage their health and wellness in a better way, a more meaningful way that uses digital tools in a secure and a private environment, but also whenever and whatever environment that entails. I mean, for the patient or the consumer, however people tend to look at them. And it also is comprised of that whole operational piece too, because health systems, obviously healthcare is a business, but operational and care delivery processes, which are outcomes focused, this tool measures that as well. So it looks at quality, safety, and overall performance, and tying those pieces together by looking at 4 particular dimensions of healthcare that would help create this mature ecosystem, which is ultimately what a number of health systems are after. So it looks at interoperability, it looks at person-enabled health, keeping that patient at the center of care, predictive analytics, and then it also looks at workforce and governance piece to make sure that, is your workforce even capable of keeping up with the advancing technology that is available that you want to implement in your system, because that's important too. It's hopefully technology is there to make someone's job more efficient so that they can spend more time caring for patients. So I work on that particular tool, and I'm also working to develop what's called a maturity model for community outcomes. And that's where these organizations, community outpatient organizations, typically things like your home health, primary care, those types of settings, essentially are caring for individuals, but they kind of don't know where to go when it comes to digital health. It's sort of like we don't have a lot of resources, but we obviously need to keep up with the changes that are taking place globally when it comes to digital health. So I'm working on that tool internally as well, which is going to actually be ready in spring of 2022. So a lot of exciting things.
So, okay, can I ask several questions?
Absolutely.
Tell me if I'm understanding this correctly. Basically, if an organization wants to understand their own capacity to be what is the status of maybe their digital front door, as people say, or how patients or consumers, depending on how you look at them, can interact with their organization digitally, kind of ranking them on a scale of like where they're doing well and where they could use some improvement, essentially?
Absolutely. So it highlights where they're doing well, but it also highlights opportunities for improvement. So it's a measurement tool. And essentially, when they answer, there's over 300 questions, there are 100 indicators in those 4 dimensions that I mentioned earlier. And then you receive a gap analysis report. So it tells you, it's a snapshot in time of where you are today. So hopefully you can use this as a method maybe for your roadmap. But because it's outcomes focused, which is the part that excites me the most, it leads me back to this quote, it is as important to know what sort of a patient has a disease as it is to know what sort of a disease a patient has. And that's essentially what we're looking at when we're talking about all aspects of digital health, because a lot of times people tend to only look at the IT team and say, hey, it's their responsibility, it's all technology. No, where do the clinicians come into play? They're going to be the end users. You need to make sure that they're there from the beginning stages so they have their input, because what IT thinks they need is not what the clinicians need. So this is a really good combination tool of how they should be collaborating to determine where they are, but then also building a roadmap for where they need to go.
Okay, so that brings me into thinking about value-based care and how you said that it was outcomes-based. One, is it tied to, like, this is hidden an improvement activity for me. I'm just like, is this an improvement activity that somebody could actually get credit for within the merit-based incentive payment system, that are like, hey, I figured out my digital health indicator and created a roadmap, and now we're on this like process to getting better in this way?
It's so funny. I would love for it to become that ultimately. So it is a global tool. So it's not US specific.
Okay.
And it's also vendor agnostic, which is great too. So it's an unbiased look at everything in your organization that's digital, your EMR, your portal, everything you can think of. But it does capture those pieces that fall under a number of regulatory requirements, payment models. It does measure all those things that build into that. Now, we may not say, oh, this is specific to value-based, because again, globally, we have universal healthcare. So that means nothing to those countries, yet we still capture all these pieces because financial sustainability is also important to them, as well as the performance sustainability in those pieces.
I love it. This sounds like such a useful tool. And so, how many people are using this now, and what are your intentions? Like, I mean, is it something you hope that like every practice, regardless of size, has an opportunity to use it? Is it free? Is it
Absolutely.
Yeah.
Absolutely. So no, it is something that I hope everyone will take part of so that they know where they are. A number of organizations actually think they're in a certain place, and it'd be nice to have an unbiased outside or a tool like this one to determine exactly where you are, so you can at least part of your strategic planning can include where gaps may fall, and you can kind of determine, where would I like to work on next based on what we have with our cost and other people resources. Let's work on this particular initiative, because a lot of health systems tend to plan 3 to 5 years out anyway. It is at a cost. There is a cost for this particular tool, but again, this is something that, based on the organization that's doing it, they come to us, we work with them, and we determine exactly what goes into it. And it's inclusive of additional interviews as well with some of the C-suite and clinicians to get a better sense, because one of the things I like about this tool in the entire process is there are some things that hospitals don't have functional yet, but they actually are in the process of doing it. So you want to kind of give them some points towards something like that. It may not be functional, so they couldn't receive full focus, but they recognize, hey, this is something really important, and we've already started this. So those interviews that are done are to capture that information to say, hey, they may have scored a little bit low here, but this is what they are working on. And actually, once that comes into play, if it's within a 1 year span, which I know is short for healthcare systems, they can go back in, change their answers to reflect that, to get an updated score to reflect those pieces. So that's amazing. I love that part about it.
So what's the scoring scale? Is it?
Oh, sure. So it's 0 to 400. And on that scale, the 4 dimensions each are 0 to 100. So they'll get a report out on all of the areas, the questions they answered, the scoring, and a total overall score of where they landed in those 4 dimensions. So they can say, wow, I kind of knew we were low in person-enabled health. We've got to beef up that area. And that's kind of more along the population health side. So they can work with those teams and determine, hey, what are we not doing here? Or what do we need to do better? Or they may be doing really well, say in interoperability. Well, let's take a look at that, and either we can, one, continue down that path, or see how we can work on the other 3 dimensions that were brought up in this particular report.
And is this the kind of process that is supposed to take place in an ideal scenario on an annual basis? Like they would be like checking themselves regularly, because I'm sure their systems could change, whatever technology they have in could change. Perhaps some workflows have changed,
right,
year over year.
Right. So I wouldn't say a digital health indicator is something you would do year over year. I think it's an enormous, it's a process that looks at your entire health system. So a lot of times you may have a huge advancement in one particular area, but in other areas it either remain the same or even pivoted, like we've all had to do with the pandemic. Right. So maybe, so in those cases, it wouldn't necessarily be useful to do that year over year. But if once you know your score and where the gaps lie, once you've made an achievement in a particular area, I think that would be useful for someone to go back in and say, you know what, we've made a number of advancements here. Let's go ahead and take it again.
Okay, so can you tell me, how did you get into this sort of thing?
Absolutely. So I have one of the most unconventional paths to nursing and digital health that I've ever heard of.
I want to hear it. Let's hear it.
Okay, so I'm what is referred to as a second career nurse. So I never set out to become a nurse. Nursing chose me, despite having many family members in healthcare. My mother's a retired nurse administrator over 40 years, but I actually was involved in business. My undergrad is in international business and finance. And when I got out of school, I went to school in DC at Howard University, and then I moved back to Miami, where I'm from. And I basically temped for 6 months and while I was job searching, and I landed what I considered then to be my dream job. And it was at a global nonprofit where I worked for 5 years. But that global nonprofit helped me hone a number of skills. Essentially, they took career professionals working in the state of Florida, and they paid for them to travel to the Caribbean and Latin America for short-term technical assistance and training to their counterparts in that region. And what would happen is we would receive written requests for a specific type of assistance needed. I'd present them at our staff meeting, and then we'd answer all the questions associated with the project. If it was approved, I would then collect a series of resumes of qualified professionals. I'd submit it to them, to the requesting organization in country. And then they would select who they'd like to provide that technical assistance and training. By short term, I mean like anywhere from 5 to 10 days. Okay. But then I would essentially be responsible for providing the professional volunteer. I would also give them an in-depth orientation, that person on the country, the cultural sensitivity, safety, information, food, all of those pieces. I would make their accommodations. And the only thing that the requesting organization was responsible for was transportation to and from the airport and to and from the site where they would be working daily for safety reasons. So it was a great mix of like program management, strategic planning, international relations, and relationship building, because I was also responsible for identifying and facilitating opportunities for support for regional and global partnerships, all those pieces, working with the US State Department and foreign government officials. And I totally enjoyed that work that I did. I was responsible for 12 countries in the Caribbean, and it was great. And while I did that, I also returned to school, completed my master's. I was working full time, and my master's was in like African New World Studies with a focus on policy. And once I completed that, it had been 5 years since I worked at the organization. And I was like, I want another challenge. And I decided, okay, well, there was no opportunity for me. I had reached the peak for where I was going to go as a program officer at the organization. So I moved to New York. And I decided, okay, I'm going to move to New York. I started a consulting company where I basically worked for a temp agency, but I found out I could put my temp agency jobs under my business. So those were considered consultancies. And the goal at the time was just trying to work for the UN. That was what I wanted to do. Or something that closely aligned with that type of work. And I started consulting, doing a lot of great jobs in New York. But I don't know if you know about the New York temp system, but those positions were so amazing, very different from South Florida. They were phenomenal and they actually paid really well. And I landed a great opportunity with a women's nonprofit organization, the Miss Foundation for Women. And it was great. I was a grants administrator there. It was a new role they were creating, but this organization basically provided funding and training to organizations throughout the nation focused on improving the lives of women and girls. So it was through leadership, expertise and financial support, also through social policy, economic security programs. All of those pieces were built into this job and it was amazing. And I totally enjoyed working there as well. But I wanted to work at a director level and there wasn't any opportunity for that level while I was there. So, and I also miss global work. So after about a year, I left them after I let them know that I enjoyed working there, but I did need to move up the professional ladder. They understood and they totally agreed with me and they were sorry they didn't have a role for me at the time. But at that point, I moved back to DC, Washington, DC, and I did what I always did, temp work while I was job searching. And after about like 7 months, another great opportunity opened up for me, which was a full-time job at another women's nonprofit organization. But this time it was a global organization, Vital Voices Global Partnership. And it was a director position, director of the Global Leadership Institute. And at that job, they essentially invest in women as well, but globally, who are essentially trying to solve some of the world's greatest challenges, from gender-based violence to economic independence, political and civil leadership, you name it, human trafficking, everything. And I just thought, wow, this is exactly what I want to be doing. So I was doing that for a couple of years and I was responsible primarily for projects in Russia and the former Soviet Union. And then I also completed projects in Africa. And again, it brought me to a number of different places across the globe. And one day, out of the blue, my world was transformed forever. My seemingly healthy older brother, he was only 2 years older than me, he actually died at the age of 32 from a heart condition that he did not know he had. He only grew up having asthma and that's all we knew. But I spoke to him 2 days before. He sounded like he had a cold and he's like, oh yeah, my asthma acting up. And what happened was he went into cardiac arrest. And while they were treating him for what they thought was an asthma attack, was actually cardiac arrest. And that personal tragedy led me to pivot my career to healthcare, to nursing. I just thought, what am I going to do now? Yes, I have this great job and I'm traveling the world and this is what I want to be doing, but I have no family here. I'm going to leave and go back home where I'm supported and they know exactly what I'm going through and let's see what happens. At the time, I wasn't thinking nursing school. I just said, let's just go home and get the support. And I'm glad I did. And I actually, after a few months, worked at the large college here in Miami, and it was on a health project and it was on a health campus where many nurses were, and they were like, you should go to nursing school. You're so great at this. And I was like, oh, I don't know. And they told me about an accelerated nursing program, which would only take a year because I'd already had a bachelor's. So you just go straight into your nursing work. And I was just like, I think this is what I need to do because I felt the need to give back in a way that I hadn't felt before, where I felt like, okay, I need to be an advocate for others who have experienced something in the healthcare system, where either physicians had too many patients and someone dropped the ball, or just how come we don't find out some of these things that we need to find out about in terms of gaps in transitions of care? All those things came to mind. And I said, okay, the only way to fix this was to get involved. And so I went back to school, excuse me, and I became a nurse. I got my bachelor's in nursing. And I thought that would be my way of affecting broader change at both the population level as well as the global level, caring for individuals when they're at the most vulnerable state. So that is how I got into nursing.
Can I stop you for a second?
Absolutely.
First of all, I'm still going back to the very first nonprofit where I'm like, that sounded like a little bit of like miniature Peace Corps. Like little bit like you're like, I'm the administrator for a smaller version of the Peace Corps. And then you're like, okay, then guess what? That's not big enough for me. I have bigger dreams. And what I'm gathering from you is that you're like, you have this embodiment of what you can be and what you could become. And you're like, and I like this like desire for more, to not only just to give more, to be more, and not in simple projects either, where you're like, okay, no, I want to have a global effect. And and I like already I'm like, I love that about you. I love that you're just like, okay, I am capable and smart and talented and giving, and I can do this. And not only can I do this, I'm going to work my way up. And I'm like, yep, this isn't it. There's more. I can, like
that is me. It's so funny you said that. I think the international component definitely comes from my parents. The fact that they are from Jamaica and they're always giving back. I think just knowing some of the adversities they faced moving here to the United States, just, for in search of this American dream, which I believe they found, it was one of those things where I was just like, always remember, what made them them. And they've always encouraged us to give back. So I feel like whatever I do, I want to make it, on a global level so that I can affect change in that way. But then I also have like this overwhelming sense of curiosity and also this insatiable appetite to never just settle. If I think there's more, I'm going to explore it. And I will be the first to tell you that I am like the person who is, hey, I am the one that's the disruptor. I proudly so, if it's going to affect change in a good way. I am the one that's going to do that.
Like I want that energy. Like I wish I could have it through like osmosis, or there was like some sort of contagiousness of it. I'm like, that's the kind of thing that we need, right? That you're like, yes, I can.
Absolutely.
I talk to so many women who, well, just in their life, just kind of get scared, and it sounds like you're like, nope, like bring it.
I think, what's funny? I think I'm more scared if I didn't pursue it. And now I have children, my husband and I have 3 children, 2 are girls. And I always think about it. I'm like, wow, but then you might not have time for this and you might not have time for that. And then I'm like, but what will I be teaching my children if I kind of showed them that I limited myself? But I'm going to tell them, never limit yourself. I think they need to see me doing that and say anything is possible, in order to actually do it. I'm not just saying it, I'm walking the walk and the talk. And I think that's part of it as well. I'm just like, if I didn't try, then I think that would be a disservice to myself.
Well, and I think that every time you've been able to accomplish something, you're giving yourself the evidence that you can do it. So Absolutely. If you're like, hey, I've already done this big, audacious thing once or twice or 3 times, like what's another one?
That's so true. And it's funny because I will tell you, so nursing was the beginning, but that's not even the information technology piece.
Right. So, okay, continue. I just had to stop because I was like, can we just pause for a second? Because all of this already is a lot. And I'm just...
I understand. And I was just like, yeah, that same energy from before nursing was carried into nursing.
I love it. Well, then you like, it's not like that knowledge goes away. You now are in a position to reapply it and add purpose to it. So you have your
Absolutely.
personal story with your brother that is like, okay, now this is even more meaningful. Okay,
Absolutely.
so continue. Where'd you go from there?
Okay, so my first entry into nursing was actually working in the emergency department, which never thought I could stand the sight of blood. And here I am in emergency department, the last place I thought I'd be, but I loved it. I loved the organized chaos of it all. I also loved the variety of cases I was able to see and participate in by providing care. But after being an emergency department nurse for a number of years, I also felt like, am I really affecting change? The kind of change that I was looking for when I pivoted my career. And I said, I felt like I was affecting a person here, a person there, but I really wasn't affecting that broader change that I really wanted. So I decided to explore other areas of nursing so that I would determine where I could make the biggest impact for patients. So then I became a case manager inside of a hospital. I realized that was not for me. The focus there seemed to be on removing patients from the hospital system after a number of days because maybe the insurance ran out. And I was like, absolutely not. I was a case manager outside of a hospital for a health organization. Wasn't the right move for me. And I just quickly realized that it wasn't my niche. So I decided that it was something that I was going to go and work in home health care while I still worked in the emergency department to keep up my skills. Home health care, that environment was pretty interesting, but again, still was not affecting the broader change I was
You're
looking
like,
for.
this is just one home at a time. That's not big enough.
That's not and so it's funny. So that I became a nursing professor where I thought, okay, I have a lot of training experience and background. I want to share my knowledge and teach students, exactly what I learned and kind of help prepare and shape those minds. I actually really enjoyed it. I just didn't feel like that was, I felt like I was affecting students going into the nursing profession, but I still wasn't affecting the larger group, meaning the average patient, right? And so that's where I said, okay, I'm gonna leave this aside, and I became a nurse manager at a really large insurance company here, and I worked in the continuity of care where we worked on patients who were they had a number of comorbidities, but essentially once they're hospitalized, there were alerts that were given, and I was responsible for working with the patient, keeping them healthy at home, but through the telephone. So essentially, I'd contact them once or twice a month. We'd go over any issues that they may have had. I would provide any type of clinical advice, but I would also find out if they had just had a hospitalization. Hey, is everything okay? Did your home health contact you? Did you receive everything that you were supposed to receive? And if they hadn't, I wasn't allowed to take that on because I wasn't a case manager, but I could call on behalf of the patient to just let them know, hey, this person's missing this and they're waiting on it, to help hopefully speed it up, because when they hear that you're with the insurance company, they tend to move a lot faster.
Right.
So that was actually helpful. And I enjoyed that too. I did that for a number of years. And I also became a certified health coach while I was doing that. And then I decided to do my doctorate. And I do my doctorate in my doctorate's in health sciences with a focus on global health. And I felt that that was something that would tie my past experience with my nursing experience. And after completing that is when I moved on to population health, working for a population health consulting firm. And I was training physicians and their care teams on optimizing their clinical workflows and improving the quality and performance, ultimately leading to better outcomes for the value-based care that you mentioned earlier. And I really enjoyed that. And I did feel like I was affecting change, not on a global level, but I did feel like I was affecting change, and I enjoyed it. And they learned a lot from it too. It was very giving, that environment, to hear physicians and other providers who really wanted to do more, but felt like they were stretched, right? Yeah. And this was an opportunity for me to share from a nursing perspective, who spends, nurses tend to spend more time with patients anyway in the rooms, and they tend to know more, but showing them, hey, why don't you siphon off some of these pieces to the nurses, because it is within their scope of work to do this, and it'll give you more time to spend with your patient. you shouldn't have to do all these pieces. So if you give them a clinical workflow that is where everyone in that office, from the medical assistant to the nurse to the physician, works at the top of their license scope, then it removes a lot of that burden on the primary care physician. And so they're able to spend more time with their patients to get to know what's really going on with them. And the only reason I left, excuse me, that particular role was because there was an opening for an IT position at a company, a global health group, a physician management group. Marco, strike that. But it was at a physicians group, a large physicians group, and it was for a clinical systems manager. And the only reason I applied for that was because I actually, in the past, as I was working in the emergency department, how I got interested in IT was actually from go lives. So at one hospital, they were doing a go live from one EMR to another EMR, and I volunteered to be a super user, and I enjoyed it. You know, they taught me as much as I could learn, because I just kept saying to myself, I don't have a lot of time in the ED. I need to know how to use this product properly. And that's why I volunteered. And it worked out so well. I ended up teaching my peers, and that's what the purpose was. And then at another hospital where I worked, we were on paper, and we moved from paper to EMR. And that was a completely different implementation experience, but it was great. And it sparked my interest in information technology. And that's where that came about. And someone said, hey, why don't you do this on the side? There's a lot of consulting things that you can do when you still keep your job. So I did that. Where
like you have all this free time.
I just, but it was so interesting to me, because I was just like, wow, yeah, because there's a lot of work that you're responsible for when you're caring for a number of patients. And a lot of times the patient to nurse ratio is so overwhelming. Right. It was really nice to see that I could affect change in the way where I would say, hey, let's streamline your workflow for your patients, because then you are able to better care for them. There's less chance that you'll burn out from the stress that's associated with it, because I can help you find how to click here, 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 and there, where you don't have to go 6 different ways over here. Yeah. And that was it. I was just like, this is it. This is what I need to be doing. I don't know where, I don't know how, but this is what I need to be doing. So when I went to that physicians group and was a clinical systems manager, I was responsible for implementing one homegrown platform and one vendor-based platform for 2 different types of providers, anesthesiologists, and also for our neonatologists throughout the country, about 600 locations. And our team that I was responsible for was responsible for implementations, but also the management of those tools once it was implemented. And that was my entree into IT prior to coming to where I am now at HIMSS, where I feel I'm a kid in a candy store.
If I could review, I feel like you live and breathe campground rules. Are you familiar with campground rules?
I am only a little bit, not too much. I've heard it, but I can't tell you I know all of it.
The rules are you leave your campground better than you found it. That's it. That's it. You're going to go out and whatever it is you're going to do, you're just like, you make it better.
Thank you. I love that. It's funny. My mom has taught me that. She's like, wherever you go, you always make it better. Doesn't matter how you found it, but you make it better, because they know you have been there, and people learn from what they see.
Well, and if you're doing that and people are following in your footsteps, hopefully you get a positive feedback loop that, you know, we're continuously improving versus, you know, the opposite.
Absolutely. That's a hope. That is definitely the hope.
Wow. Okay. So what do you think about 10-year-old Natasha? What do you think? Would 10-year-old Natasha be proud of? I don't know. What if you're like, I'm 32 myself? I'm just like, how'd you do all this?
You know what? I think 10-year-old Natasha would never have seen the path go in this direction to get to where it is. Because I will tell you, my mother always said, you just need to be a nurse. You need to be a nurse. I'm telling you, you need to be a nurse. And I was like, absolutely not. Absolutely not. So to see all of the things that I've done that I enjoyed, but then it still looped back into this nursing and healthcare, I was just like, wow. was like, how'd she know?
You surprised yourself. You didn't surprise your mom, but you surprised yourself.
Absolutely. Absolutely. But you know what? I don't regret it. It's one of the best decisions I ever made, because the one commonality I do believe we all have, it doesn't matter what views you have, what side of the political fence or anything like that, is we all want to be in good health, right? And we cannot pay to have the best of health. Things will happen, and you just hope that you're as prepared as you can be. But I realized that everyone is in the same position no matter what. When they came into that emergency department, I never asked for their insurance. And sometimes they'd be offering their card. I said, I don't care about it. I need to take care of you. That's not my job. My job is to care for you. And that's it. And I love being in that position. And to me now, it's changed a bit, but it's changed in a way where I just want to be able to provide you with the best information available that is correct about healthcare on a whole, so you as a patient can make a better informed decision. Doesn't matter what it is, but I want you to be able to make the best decision, but you're armed with all the information you need to make that decision.
I love that. So, advice for people maybe following in your footsteps or just starting their career? I mean, sounds, if I you're going to be like, go big or go home. That's what I hear.
Oh my gosh. Okay. So I would go big or go home. No, I would say, you know what? Always remain curious. Remain curious. Always ask the questions. Find out what's going on. And maybe it doesn't exist yet, but maybe it's for you to explore so that you can create it, whatever that may be. Don't settle. Do not settle. I think that's the biggest injustice anybody can do for themselves. You never want to look back and be like, what if, or I wish I had done this or that. Do it.
I'm going to take that to heart, even for my own life right now. Like, I appreciate that. Yeah. Well, Natasha, this has been a wild ride. I feel like following your journey is just like taking me all over the world, and with all kinds of like good deeds being done and like lives being changed for the positive. So like, thank you for this time. And thank you for everything that you're doing.
Thank you.
If people want to connect with you, follow you, or, find the digital health indicator and take that quiz, like, where would you direct them?
Oh, I would direct them to our HIMSS website, HIMSS.org. And you can just put in the search bar digital health indicator and it'll pop up. And you can certainly, you have an option there to explore and have someone contact you to just reach out and have a conversation about it. And certainly they would tie me in since I'm responsible for it. So if you had any other questions, feel free to reach out. I'm absolutely available to help.
All right. And if they want, do you prefer to get contacted on LinkedIn, Twitter? Does it matter?
Sure. I'm not on Twitter. Oh, I'm sorry. I'm on LinkedIn though. Natasha Ramontal, Ramontal.
Got it.
And you can reach out to me there. Certainly we'll connect, and however I could be of help, I would love to.
Wonderful. Well, thank you so much for this. I'm so excited to share it with our audience.
Oh, thank you so much for having me. It was really fun getting to know you and having a conversation today.